Welcome to Education Today. I'm Mai Gladaszewski
And I'm Emily Dinko.
of Armstrong High School in Armstrong School District.
We all know that taking care of your body is the utmost importance if we want to continue to get the most out of our lives. There are many different ways that one can take care of their body. The obvious is being to watch what you eat and exercise. There is another very important thing to do. However, you need to pay attention to your body and understand what it is telling you.
Often, your body will give you indications that something is not right. For example, your stomach will let you know when you're hungry, or if you maybe ate something that does not like your system. Learning and understanding the signs that your body is putting out can not only help you feel better, but it can save your life. Tonight, we are going to talk with a local professional to learn more about a stroke, what it is, or how to identify or maybe even prevent them. Welcome to Education Today.
Can you please introduce yourself and tell us what you do?
My name is Ann McDermott. I am a physical therapist by background. I work at Armstrong Hospital, ACMH Hospital. I'm the director of the inpatient rehab and skilled nursing units, but I'm also the coordinator of the primary stroke center. What we're talking about today is stroke, so I will tell you that as the coordinator, I am responsible to make sure that certain requirements are fulfilled to maintain our certification. To be certified as a primary stroke center, you have to be able to meet certain criteria, meaning providing the same level of care for an acute stroke 24 hours a day, 7 days a week. And there is data that must be collected to validate that, and then we are recertified every year to ensure that we're meeting the standards.
Mm-hmm. How did you become involved in the field?
Well, as I said, I'm a physical therapist by background, and I manage 2 units on the hospital which deal with rehab. And most stroke patients require some type of rehabilitation after their stroke. So I worked a lot with stroke patients, and it became apparent that it would be helpful in this community to have a program that could ensure the appropriate treatment of stroke for anybody who came into the hospital. So obviously I had a vested interest in patients doing well, and that starts with managing their stroke from the beginning.
What are some of your job responsibilities?
I organize the meetings for the group of professionals in the hospital who oversee the stroke management, and we review cases, and I am responsible for making sure that staff get the type of education that's required to stay current with stroke treatment, and then making certain that the data is collected by various individuals in the hospital so that we can maintain our certification.
So tonight we are going to talk about strokes. What exactly are they, and what effect do they have on our body?
Well, a stroke is a disruption of the circulation. It is either a clot that forms in the brain or a bleed that occurs in the brain. Either way, brain tissue is deprived of blood and the oxygen that it carries, and then those areas of the brain that would have been supplied by that blood are damaged. So whatever part of your body correlates to that part of the brain is then affected as well.
What is TIA?
TIA is a term called transient ischemic attack. They used to be called mini strokes. More and more they're called early strokes or warning strokes now, because about 15% of all TIAs go on to become a full-blown or larger stroke. But transient is the operant word there, meaning that it's a temporary situation. You may have just a brief type of symptom like numbness or tingling or sensory loss or confusion or balance disruption, but it goes away. So transient ischemic attack means there's a temporary loss of blood supply to some part of the brain, but typically it resolves completely in a short time.
What indications may your body be putting out there that may identify that you're having a stroke?
Well, we try to use the acronym that's been kind of promoted by the American Heart Association, American Stroke Association, called FAST. And those letters correspond to areas of the body: face, arm, and speech. And those are areas that are very commonly affected early in a stroke. So you would see some sort of problem with a person's face, typically asymmetry. One side looks different than the other. Perhaps the mouth is drooping. Perhaps one eye is not blinking the way the other one is. And if you notice that in yourself or someone else, that's a very clear indication that you could be having either a TIA or a stroke. A corresponds to the word arm. In the same situation, you might ask the person to raise their arms, and perhaps one arm doesn't raise as high as the other, or it starts to drop quicker. Again, it's an asymmetry. S correlates to the word speech. Has there been a problem with the speech? Is the speech changed all of a sudden? Are they not making sense? Are their words slurred? Are they having difficulty moving their mouth? The other part of all of these things, FAS, face, arm, and speech, is that it's a sudden change. You see something that happens very quickly in one of those areas. And then the letter T in the word fast corresponds to time. If you see any of these things happening in their face, arm, or speech, it is time to call 911. The other new meaning for the word time is that they want you to notice at what time this happened, because one of the important indicators in how to manage a stroke is when was the last known well time. So if someone starts slurring their words at 1:30 in the afternoon, that is the last known well time. So you want to take advantage of all of those letters to help you remind you of what could be a stroke, FAST.
People sometimes associate strokes with heart attacks. Are these two things related, and what is a primary difference between the two?
Well, clearly both of those involve some disruption of the circulatory system. With a heart attack, there's not blood getting to the heart, causing it to malfunction. With a stroke, it's a disruption of blood to the brain. So that's the similarity. Typically, if you have a heart attack, it's going to affect your entire body and its ability to function. Excuse me. With a stroke, the part of the brain that's affected correlates to a part of the body. So depending on where you're seeing the damage, that will correlate to some sort of disruption in a specific part of the body. One arm, one leg, one whole side of the body, perhaps someone's vision or speech. It can be a small amount of disruption, or it can be a massive amount, and it can be a slight amount of weakness, or it can be total paralysis. It's variable depending on how much of a problem there is. And a stroke can be caused by one of two things, either a clot, where blood is not getting through, or a bleed where there has been a bursting of a vessel and blood is not going where it should be because the vessel has burst.
Okay, that was my next question. What can cause or bring on a stroke?
And certainly there are some things that a person could have as an underlying condition and not know anything about, like an aneurysm. Perhaps they've got a weakening of a vessel in their brain, and it maybe has been there since birth or for a long time and never caused any problem, and they'd be unaware of that, and then something happens to cause that vessel to burst. Typically it's a high blood pressure situation. But there are other things that contribute to a stroke, and they are typically underlying health conditions, such as diabetes, obesity, smoking. Even sleep apnea has come to be known as a risk factor. Having a sedentary lifestyle, not getting enough exercise, high blood pressure, heart disease, things like gout, atrial fibrillation, poor diet, even drug abuse. So all of those things can contribute to conditions that can cause a stroke.
There seems to be an idea out there that strokes are hopeless. Can you address this?
Well, that used to be the case, and it is the largest cause of disability in this country. It's the fourth largest cause of death, and it has been thought that once a stroke happens, there's not as much that can be done as what can be done to prevent the stroke in the first place. So the American Stroke Association actually believes that 80% of strokes are avoidable, are preventable by managing these conditions that contribute to stroke. So what is more hopeful now than what was in the past is the treatments that are done acutely to minimize the damage done by the stroke. So there are treatments that are very time sensitive, and you have to get access to them as quickly as possible, and you have to know where to go to get those. So there is something called Primary Stroke Center, which is a certification, as I discussed, that Armstrong Hospital has, and emergency medical folks are mandated by law now to take patients via ambulance to the nearest primary stroke center when it's at all possible. So what is hopeful is that these treatments have been proven now to be very effective if administered quickly and under the right circumstances. But you have to know where to get them, and you have to make the efforts to get there in a timely fashion. With regard to the damage done after a stroke, again, it is the largest cause of disability in this country, and stroke can be devastating. There is always rehabilitation, but depending on a person's age and the severity of the stroke, the recovery from a stroke is questionable and typically not complete. So the most important investment is in trying to manage the stroke as it happens and minimize the damage early on, and more importantly, to prevent the stroke from happening at all by managing your health conditions.
For those who want to learn more, where can they go to obtain more information?
Well, the most important area is the internet. You know, you can Google stroke and see a whole lot of different information from different facilities, but there are two huge groups called the National Stroke Association, and I believe their website is stroke.org, or the American Stroke Association, and that's strokeassociation.org. But again, if you just Google stroke, those two will come up pretty quickly. And they are just a wealth of information about treatment, about underlying conditions that can be managed to prevent stroke, and what to do if you've had a stroke to prevent having a second one, and all of that sort of information.
Is there any other information that you'd like to share regarding your job or information that you feel people should know and understand?
Well, the saddest thing we see with the stroke program are folks that come in whose symptoms began much earlier. You frequently see people who had symptoms that started the night before, and they thought they would just maybe go away overnight, or they didn't seem severe, so they just thought they'd sleep it off or wait and see what happens, and valuable time is ticking by. I think our country has done an amazing job in getting the word out about cardiac events. Time is heart. You know, the sooner you get to a hospital with a cardiac condition or a heart attack, the more heart muscle that is saved and the less damage. The same thing applies to a stroke. Time is brain. Brain tissue, once damaged, can't be recovered. So the important thing is to minimize the damage early on. And unfortunately, with stroke, the symptoms can be a little more vague. Obviously, with a heart attack, you frequently think of someone having chest pain, and that would be a strong indicator that you need to go get help. With stroke, the symptoms can be more complicated. They could mimic a migraine headache. They could mimic Bell's palsy. They could be something that doesn't seem like it needs immediate care. And I think individuals are frequently embarrassed to think that they might go to the hospital and find out it was nothing, so they wait to see what happens. And that is so frustrating when you see a patient who could have benefited from one of the time-sensitive medications who isn't eligible by the time they come into the hospital. So that's the most passionate thing I have to say is err on the side of caution. Don't take any chances. If you're having anything that could be construed as a symptom of stroke, go to a primary stroke center as quickly as possible and have it ruled out. That's the worst thing that could happen, and the best thing that it's not a stroke. But even if the symptoms are going away, people are encouraged to go and have it looked at, because it could be, as I said, the precursor to a big stroke. It could be a TIA. There could be some blood work and testing that's done that indicates that the person is having an underlying condition that can be controlled, thereby avoiding the stroke completely.
Okay, thanks very much. We are going to take a short break, and we'll be right back with Armstrong School District's Education Today.
All your professors, all of them, they know that all it takes is one dreamer with passion, one person, and they hope in each of you that you might be that one who makes a longer-lasting light bulb, who writes music for the ages, who reaches into the mind and discovers a new star, and who can change the world of a fifth grader. We're gathered here to hope in you.
We're We're back with Armstrong School District's Education Today. Tonight we are talking with Miss Ann McDermott about strokes and how to identify them and how to prevent them. Heart disease can be hereditary, so does that also make strokes hereditary? If so, can you still prevent them?
There is some element of heredity in so much as the underlying conditions could be inherited, such as cardiovascular disease or things that are inherited that we can change, like our ethnicity or even our age. Those things are inherent and really can't be changed. But strokes can be prevented because there are a lot of factors that are modifiable.
I'm sure there is a stereotype out there where people may say, well, I'm too young to have a stroke, or I'm too active. Is any of this true, or can a stroke still occur regardless of age, physical condition, or activity?
Absolutely, and that's one of the reasons that people delay getting treatment, because they think, I'm too young or I'm too healthy to be having a stroke. This can't be what's happening, but it can happen to anyone. And it can be a condition such as atrial fibrillation, which is just a condition of your heart that you may or may not even be aware of, that promotes clotting, that can throw a clot that lodges in your brain. So it's not as typical for a younger person or a healthy or active person to have a stroke, but they certainly can. So that, don't assume that there's any condition or any particular person who would be spared.
Let's get to what we can do to help prevent strokes and heart disease. What guidelines should people follow?
Well, again, we talked about some risk factors that you can't modify, but there are some that you certainly can. And if I could just maybe go over a few of those. If you have high blood pressure, try to get it lowered either with medication or lifestyle changes. They talk about high blood pressure of 140/90 or higher as being a risk factor for stroke. Atrial fibrillation is an irregular heartbeat that can cause blood to kind of pool in areas of the heart and then cause clots that break off and lodge in your brain to cause a stroke. And there are medications that control atrial fibrillation as well. If you smoke, stop. There's really no other way to say that. Smoking causes so many problems, and it is clearly a condition that promotes stroke. In fact, it doubles your risk for stroke. If you drink alcohol, do it in moderation. Heavy drinking can increase your risk of stroke. Cholesterol, try to get your cholesterol under control. It's a fat-like substance in your blood, and it should be under 200. If you have bad cholesterol and can reduce it, it will reduce your incidence or likelihood of having a stroke. If you're diabetic, follow your doctor's advice to get your blood sugar under control. And very important, exercise. Exercise daily, even a little exercise, a brisk walk, bicycle ride, yard work can improve your health and reduce your stroke risk. And also cut down on sodium and fat in your diet. So healthy eating, healthy lifestyles certainly will help minimize your risk.
Let's talk about how someone else may be able to identify that someone might be having a stroke.
Well, obviously appearance is one thing. As we talked about, a sudden change in your face, your arms, one side of your body, your speech, those things would suggest that there's something going on that could be a stroke. We put up these posters in places just to remind people what it looks like for someone to be having a stroke. And it's an asymmetry in this woman's face, something that slight. And some of that could be considered normal, but when there's a sudden change, that's when we think of it as something possibly a stroke. Again, confusion, trouble speaking. It doesn't necessarily mean that they can't get the words out, but maybe the words don't make sense. So that would be something you would notice if all of a sudden you're talking with someone and that happens. Frequently, older people who are at home alone, who see this happening or know there's something, will pick up the phone and call a family member. But when they get on the phone, they're not making sense. Their speech doesn't sound right. That's a clear indication. You could have trouble with your legs as well, and trouble walking. Balance loss, dizziness, or weakness would cause you to have trouble walking. And then there's another type of stroke. We talked about strokes being caused by either a clot or a burst vessel. And the burst vessel the bleed is much less common. About 90% of strokes are caused by a clot. But when you have a bleed, it is typically accompanied by a very sudden, severe headache. They talk about it being the worst headache of your life. So a sudden headache like that is very concerning as well.
What should you do to get yourself or that person help?
Again, you need to know in advance where the closest primary stroke center is. If you don't, calling an ambulance should get you that same result. They are, as I said, required by law to take someone to his primary stroke center where you know they'll be able to offer the care that's required. So even suggest you go by ambulance. Even if you're fairly close and could drive, the advantage of going by ambulance is they can start the treatment in the ambulance. They can call ahead and get the hospital prepared to receive you and start the evaluation the minute you hit the door.
Can a primary stroke center provide everything that a stroke victim might need?
Well, the standard of care for an acute stroke, an acute ischemic stroke, which means the clot type, is a medication called TPA, and it's a clot-busting medication, but it has to be administered within 3 to 4.5 hours since the time of onset. So that is the first thing a primary stroke center must be able to do. They have to be able to do all the testing that's required to determine if a person is eligible for that medication. And for example, say you're on a very high blood thinner for another condition. You might not be able to get the TPA because it's going to thin your blood even further. Or you are outside that window of time. Perhaps your symptoms started the night before, or 7 or 8 hours outside. You would not be a candidate for TPA. But once the center can do the evaluation, determine you are a candidate or not, administer the medication if you are. Those are the things that a primary stroke center can do, and as I said, that is the standard of care. Say, however, you are not eligible for the TPA, there are still other treatments which are becoming more and more beneficial, called interventions, something where they mechanically go in and retrieve the clot. That's called a thrombectomy. And those have to be provided by a facility that has a neurosurgeon 24 hours a day. That's called a comprehensive center. And there are, fortunately, in our area, 2 comprehensive centers in Pittsburgh, Allegheny General Hospital and UPMC Presby are comprehensive centers. But every primary stroke center is affiliated with a comprehensive center and can make those communications. At Armstrong Hospital, we actually use the comprehensive center at UPMC to provide telemedicine support to all of our stroke patients who are candidates for these type of interventions. So it still makes the most sense to go to a primary stroke center because you'll be triaged, get the evaluation and the treatment started, and if you require something more that can't be offered there, they'll transport you as quickly as possible, and that's typically by helicopter from our hospital.
Should you still seek emergency care if the symptoms appear to be going away?
Again, that would be the wise thing to do because, as we said, it could be a TIA, which is a precursor to a larger stroke, and obviously there's some underlying condition that's not being managed or evaluated, and that can be done at that time. Plus, we frequently see patients whose symptoms come and go. So say the symptoms start and then they go away, and you wait to see what happens. If they recur, an hour or so later, you've already lost a big part of that window of time that makes you eligible for some of the treatments. So yes, I believe that even if you have symptoms that are resolving, you should go to an emergency room and be evaluated.
Can you tell us again where people can find more information or contact you?
Well, again, just for information about the Primary Stroke Center, you can call the hospital and ask to speak with me. Or, as I said, you can find a huge amount of information online. Google the word stroke or look at the websites for strokeassociation.org or stroke.org.
Is there anything else you'd like to add for the benefit of our viewers?
Yes, I'd like to say one more time, and I know I've said it multiple times now, if you have anything that feels like a stroke or someone you're with appears to be having symptoms of a stroke, go to a primary stroke center as soon as possible and have that ruled out or treated. Don't hesitate because you're wasting valuable time that can't be regained in terms of the treatment. The treatments are much more hopeful than they used to be, but they're very time sensitive.
Well, that's our show for today. I'd like to thank our guest, Ms. Ann McDermott of ACMH, for taking the time out of her schedule to join us. Our thanks also go out to the TV production students of Armstrong High School, led by their teacher, Mr. Josh Miklos. They were our film crew today.
Please join us again next week for another look at the Armstrong School District. DVD copies of this and all Education Today programming can be requested by contacting Chris Garitano, Multimedia Technician at Armstrong High School. Visit our website for uploaded information about the district and have a great week.